but I'll probably say what I'm doing, just because so you know exactly.
Good.
All right. And you can use the reference form up to 3 times during the exam. So lots of times I'll save one till the end, and you can reference it a couple times in the middle if you want to. So, okay. First thing I would do, I'm going to pretend you folks are the people I'm testing out to. And I escort my patient into the room. Introduce myself. My name is Ann Seffel. I'll be your nurse today. And I'm looking here at your health history, and I see that you have an allergy to penicillin. Looks like you get a rash from that. Okay.
Very good.
Any medications that you're on, like Lexapro and albuterol, right?
Yes.
Okay. All right. Next thing I'm going to do is gather my equipment and wash my hands. First thing I'm noticing as I'm coming into the room is her appearance. She seems clean, showered, good hygiene. Checking her behavior, she's alert and oriented appropriately. Her mood seems stable. Checking her cognition, her thought process seems logical. And if she is having having a low mood, I would check her for suicidal ideation. I'm going to ask you a quick question. Do you remember what you had for breakfast?
Nothing. I had melon yellow.
Okay. So
I'm a nursing student.
Okay, can you tell me what year you were born?
1985.
Okay. And I'll have you remember these 4 words for me. Boat, tree, frog, snail. Okay. And the next thing I'm going to go ahead and do is look at her cranium. I don't see any abnormalities there. I'm looking at her hair. Her hair seems... oops, okay. Right at the moment here, I would back up because I forgot to do her weight and her height. And I would also do her vital signs, blood pressure, pulse, temp, respiration.
Is that okay to go back like that?
Yeah. And then I'm also going to check her pain level from 0 to 10. 0. So, 0. Okay. All right, so I'm looking at her hair. I'm looking at her scalp. I don't see any flaking, any batches. I'm going to go ahead and feel any lumps, bumps, tender areas. I'm going to go ahead and feel her temporal artery. Sure, that'd be great. Feel her temporal artery. I'm going to check your temporal mandibular joint. Can you open your mouth on it? A little bit of a pop there. Is it tender at all? Not tender. Okay. I'm going to check your sinuses. Can I head just a little bit this way? I'm going to feel your sinuses. Any tenderness there? Okay. And next thing I'm going to do is look at your face. Her expression seems symmetrical. Her expression is appropriate for her mood. I'm going to have you lower your cheeks out, raise your eyebrows, clench your teeth, and frown for me. Okay?
Do you want us to state what cranial nerve you're
Yeah. It's okay. I have to stay in my mode. Focus on this. Do ask your question. That's what I want you to ask. So then I'm going to have you close your eyes for me. And I'm going to tell me whether it's sharp or dull.
It's cold.
Is it sharp or dull?
Dull.
Okay. All right. Close your eyes. Is it sharp or dull?
Sharp.
How about this? Sharp or dull?
Dull.
Okay. Next thing I'm going to go ahead and do is check your eyes. I'm going to have you turn this way for me. And first thing I'm going to do is check the corneal light reflex. You can see it in the same place in each pupil. So no sign of lazy eye or anything like that.
I just recently had eye surgery. So.
Did you? Okay.
Yes.
I don't know if this bothers you. I'm checking the pupils bilaterally. They're brisk, equal, reactive to light. I'm going to have you look at this and look at the wall behind me and back at this again. Accommodation is present. Her pupils are adjusting. Now you watch this. She has her eye movements there. And then I'm going to go ahead and put on some gloves that she had prepared sitting here. I'm looking at the external structures. I don't see any redness or drainage or swelling. I'm looking at the conjunctiva. The conjunctiva are clear, sclera are white, no signs of irritation in the cornea, and the irises are equally dilated. Next thing I'm going to do is ears. Okay, so I'm checking the external ear. No lesions, no sores, no swelling. So I'm going to go ahead and pull up back. I'm checking the canal. Canal looks clear. You see the tympanic membrane, the cone of light. I'm going to check the same thing on this side. See the tympanic membrane, cone of light. Good. Next thing I'm going to go on to the nose. And her nose looks symmetrical, there's no lesions. I'm going to have you sniff through one nose and the other. They are near steam patent. I'm going to go ahead and palpate. No prepatus, seems aligned. And, right.
Need what?
Oh, I need a template, but I'll just pretend to have it.
Okay. Thank you.
Okay. So I use my tongue blade, and I'm checking buccal mucosa, checking the gums, the teeth. I'm going to have you lift your tongue to the roof of your mouth, checking underneath. I don't see any growths or anything like that. Look at her tongue. Looks appropriate. I'm going to check the top of your mouth. I'm looking at her palate, and I'm checking the back. I'll go, the uvula is there, and it's midline. And I'm looking at the tonsils. They are 1+ laterally. Next thing I'm going to do is stick your tongue out for me. Okay, and then press your tongue against your cheek so I can check your tongue. Okay. So I'm going to look at your neck here. Neck looks symmetrical. I don't see any lumps, bumps, pulsations. Go ahead and wash your hands with the but I'm going to go ahead and palpate the cervical nose. I'm going to palpate a few other nodes as well. So I'm going to start here. Circular motion. Stretch your shoulders up. Okay. And also, I'm going to check for trachea, that's midline. And my fingers on each side of it. That seems appropriate. I'm going to check for the carotid pulse. That's present. I'm going to check your thyroid, my fingers on your clavicles, then take a swallow from it. I'm going to push it to one side, then take a swallow. I'm going to feel over here, and I'll push it to the other side, swallow. I don't feel any bumps. Or
Is it
enlargement.
enlarged?
It's not enlarged.
Not enlarged here. No.
It's supposed to be.
She said it was.
Okay.
She said it was going to die of cancer this summer.
It's terrible. Okay, I'm going to listen for carotid bruise. And I don't hear any carotid bruise. Next thing I'm going to have you do is turn your head sideways, left to right like this, forward, back. Okay, I'm going to have you press against my hand the other way. I'll press this way. Forward, back, try and spin your head, now the other way. Okay. Next, I'm going to look at your arms. And they look appropriate for size. I check, she'd have a short sleeve shirt on. So I'm checking the skin. Skin looks appropriate. I'm looking at the color. I'm looking at her nails. I don't see any signs of flubbing. I'm going to have it go like this in front of you. This behind you. Like this behind your head. Okay. Kind of go like this with your shoulders.